So this is Shiloh, and Shiloh's an older lab, and she's got some arthritis. She's kind of wobbly in her hindquarters. And then she's also got this big old swelling here on her elbow. You can see this big old bulgy thing right around her callus of her elbow. We see it probably once or twice a year. It's called a hygroma. What the dogs do usually is they hit their elbow and irritate the heck out of the tissue around the crazy bone. Shiloh says, well, I'm going to leave now because I'm done with my exam. So we're going to clean it up with alcohol. It's shaved, and that will allow us to put a needle in it. And you can feel it's very fluctuant, very soft. So it's pretty for, usually abscesses are much harder, and this fluid's a little cloudy, so we're going to look for white blood cells in it and see if it's an abscess or if it's just a seroma.
In the slide, if you look, you can see there's some faint reddish types discs, and they're the red blood cells. And then you'll see bigger cells with purplish kind of curved things in them. Those are the nucleus of white blood cells. Whenever there's a lot of white blood cells, it's an indication that it can be possible infections. So we put Shiloh on 10 to 14 days worth of antibiotics.
This is the hygroma we saw the other day. It was much bigger, and it had some areas that I thought might start to abscess. There was some callus areas. Sometimes what happens is in older dogs, as they hit their elbows, they will, or if they get the calluses that get infected, then the infection will go inside. What we saw inside when we took a sample is we saw some cells that were white blood cells, and we saw red blood cells, kind of signs of irritation or infection. This is a terrible, terrible area to wrap, and I've tried all kinds of different wraps, and a lot of them come off, so I've kind of just gone to wrapping, not real tight, but just kind of like a football pad or skateboard pad on the elbow. So when you skateboard or you rollerblade, you can wear elbow pads. And so what I do is I just kind of put the tape right on the hair, because if you put the tape on the hair and you don't do it too tight, then it stays on. And what that does is it protects this fluid-filled sac, and it keeps it from swelling up, and actually puts compression on it, and it makes, she keeps looking at it, it makes it go down, and also gives it support. Well, it gives it support from being hit, and also, I'm sorry, it's pulling the hair on the inside when she walks. So you got to make sure the hair is all away from the inside, because you and I wouldn't like that either, right? Every time we walked, it pulled on some hairs. That wouldn't be a good day. So anyway, we'll leave that on for another 7 days, and then we'll check it out and see how it's looking next week. What do you think, Bud? So the thing is, it didn't get the abscess didn't develop in there. It's still very soft. She's on antibiotics. We're going to keep it wrapped, and we'll see what's happening.
So the hygroma in dogs is when the point of the elbow, or like our crazy bone, is hit and starts a little fluid that leaks out between the bone and the skin, and it makes this big pocket of fluid. And on dogs with calluses, that fluid can actually become infected by if the callus outside, say a dog lays on the concrete all the time, and that's one of the causes, and they really get cracked, thickened skin there, and the bacteria go in through those cracks, it can infect that pocket of fluid, and it can cause an abscess. And that's what I was looking for. I wanted to see whether the cells in the sample were actually a lot of white blood cells, which would mean I should put Shiloh on antibiotics. But if I just see red blood cells or hardly any cells at all, then I know it's just a pocket of fluid that needs to be bandaged or put in a sling. And I don't mean a sling like keeps the leg up. You can see the sling I mean. It's a padded Velcro bandage that goes on the points of both elbows. Now, no matter where that hygroma is or that fluid filled pocket, if it's not infected, if you can keep it padded like this or with a wrap like I showed you, then the hygroma will go down with time. If they're infected and antibiotics don't take care of it, if it's a major infection, it may have to be actually lanced and drained and have surgery done on it. But I'll tell you, they are really hard to heal, especially for those older dogs that are laying on their elbows or are sore and they don't get up and down much. They lay on their elbows. That's it's hard to get them to heal, and they oftentimes can break open again and bleed and get worse. So we try to pat them when we can, and if we can't, if they're infected, we'll try to do surgery um, and help them get along. In this case, Shiloh's did fine with the antibiotics after we found out that it wasn't too infected. The antibiotics helped, as well as a good wrap. And remember, you can use that padded sling too that you can get off the internet. All you have to do is look up Hygroma padded bandage, and they are for sale, and they're very helpful. So check out my books, Dog Dish Diet and Feed Your Pet to Avoid the Vet. They're available on the internet. My website's getting rebuilt right now, so it's not up, but you can always Google them and look them up if you have a dog that has allergy problems or you want a home cook for your dog and your cat. Have a great day.